126th position. So this is really a very, very alarming situation, though we feel that we are all into one good position. So now coming into the context of the dimensions of happiness index, the main thing is we have a few dimensions with which we are always discussing. So first one is the life ladder, where we always feel that we have to have a life satisfaction and we grade it. So it's just a simple question. So they ask and we just go about seeing where are we standing in the life satisfaction. Then the most important is the GDP. Here it reflects the economic prosperity and the resource access. I think we always, when we talk about GDP, we think, okay, we are rich, they are poor, our economy just stands there. But it is all depending upon any aspect of activity that you take around you all. It is more towards the economic prosperity and the resource constraint. I think today our topic is more related to health, but I think our context will be set where with the constrained resource setting, how are we working towards providing better health care? Then most importantly, today our topic is health life expectancy. This is the number of years a person can expect to live a good health. But I think here is always a discrepancy within all of us. We all think, okay, now I'm hale and healthy, but we are all not very sure what is going to happen to us the next moment. So where are we? Are we all in good health? What are we working towards to maintain our health? Then comes the social support. I think all of us do agree with us. Now, anything and everything, it is only the society or the social networks that we are connected to. So we need to see what are the support system that we are working with. And then is the freedom to make life choices. I think everywhere from our childhood to the point where we go to our professional lives, we need to have the freedom to take our own choices. I think we are lacking there. And the generosity. We all have money, we tell we have money, we have these resources, but we are not generous enough to share it with our community. So according to the entire, and most importantly, I think all of you all will agree, all these things stands very personal to us. Maybe life, health and other things, maybe the public aspects have to set into place. But the most important is the perception of corruption. I think wherever we go, we always try to relate things, whether this is under corruption, whether we are cheated in some form or the other. So I think the World Happiness Index has very beautifully articulated the concept of happiness into these 7 dimensions. But today we are going to concentrate most on the health part of it. So why is health very critical to happiness? We all know physical health is very, very important. Then comes our mental health. These two things very, very often relate to each other, and we tell physical and mental health is very, very important. But very importantly, now we all know the influence of social media and how our social networking is there. We are often falling prey of our social and emotional well-being. I think that needs a special concentration. See, under health itself, we have something very importantly, economic stability and health. See, not that everyone is able to access the equal treatment or the care facilities. Or maybe we are having money, we go to the corporate health sector to get the treatment or care. But another to a tertiary government hospital, or if we have a specialty, I don't know where we are going, our own maids or servants at home. We are lost how to help them out because we are going, but we cannot provide the same kind of service to them. So that also plays a very, very major role. So the critical aspects are concentrate on a physical health, mental health, more importantly, the social and emotional well-being, and at a large on the economic stability and health. Then coming to the next one, we are talking in general about all these aspects. But what about India's health status in relation to happiness? So when you take about the health expectancy, life expectancy, you won't believe we are in the 123rd position according to the United Nations. So we still feel that we need to go a long way, a significant number of years are there with us to be away from the poor health and transform ourselves into the good health and have more number of years of life expectancy. So the individuals may live longer, and we must have years that are without illness and disability. That is the most important aspect of life expectancy. And how is it going to impact on the happiness? That is, the healthier populations experience fewer years with illness and enjoy more productive life. I think all of us, from our Vedic times, with all our spirituality, our mental health exercises, everything what we tell, you be happy, surely we are going to go towards a healthier life and more life expectancy. So that's what we wish to convey through this particular Uvakai Foundation. So I just wanted to give a small statistics. I think all of us know that we are globally ranked #1 in our population. This is a live statistics I just took a few minutes ago. So we have crossed this number. This is very, very alarming, but you have to just see the change. Yearly changes, it is about 0.89%. This change is happening every minute. And you have to see the global share. We are 17.78%. So we must all accept the fact that how much of challenges we are going to face in relation to the health sector or at a happiness at large, contributing to those 7 factors. So when you see at the global scenario, the overall life expectancy at birth is 73.3 years. But to see our India's data, it is 72.2. You won't believe Dr. Vidubala and myself had a discussion few minutes ago. Why it is 73.3 and 72.2? 72.2, it's just 1 year difference. Why that is? But you won't believe with the 200 countries, still we are 123 years, 123rd position. So that 1 year is also causing a big challenge in terms of economy or in terms of the overall happiness, which is contributed mainly by the life expectancy. So it be 1 year, 1 day extra, 1 month extra, it is contributing to the entire happiness. So we should concentrate and always deliberate on how to bring about happiness to improve the life expectancy, not only in terms of only physical health, but on the other aspects like mental health, social and emotional well-being, and largely the economic stability. And seeing this thing from 1955, I think we are slowly increasing because of our total educational setup, our governmental support. Lot of activities are just going on. But still we have to work towards, because we are always seeing at a superficial level, at the urban scenario, okay, we are all growing, we are all happy, going around, we have malls, everything is happening around us. But we must always relate ourselves to the other social scenario, other communal activities. What are the other community developments? What are the rural activities that are going on? There, I think there is a lot of disparity where we have to be competent enough to go along and reach the level we really need to reach. And I think all of us know about this. What are the health challenges affecting happiness? The chronic diseases and lifestyle, healthcare inequality, and mental health neglect. I think all of us here would agree with these 3 main challenges. Diabetes, health, disease, or everything more related to urbanization and lifestyle changes, really it impacts the happiness level. And I have spoken about the healthcare inequality. Surely the quality of treatment that is existing across the socioeconomic status, this barrier has to be really distorted to improve our overall well-being. And the mental health neglect. We always feel that physical health is given more importance and mental health is always seen at the backyard. I do not know. Maybe we are all at the urban level, we are all coming towards it. We are seeking the support when we are providing support. But we have to see that everybody should be on par on the mental status also. And coming to the government initiatives and health improvements, we really need to applaud towards the government. There are a lot of new activities. I think all of us know about the Ayushman Bharat scheme, where our health coverage has been taken care by our central government. Poshan Abhiyan, a very good scheme where it concentrates on the malnutrition. It caters to every child. The health monitoring is taking place so well. from the ICDS center. I think every other data is accounted very nicely. And the next is our Chief Minister Breakfast Scheme. I think many of the states have started it, and we are all part of that scheme. I can just see that a lot of activities are going on, and we are able to see that there is improvement in the health status of the children. Their concentration has improved. And coming to the mental health policies, I think the National Mental Health Program really addresses a lot of issues, but these are all at the government part of it. So are they penetrating 100% into the community where we are attributing, or we are all always feeling it as a challenge? Is it reaching the grassroots level? That's the question remaining for us. So how are we going to link the health and happiness in India? So first, why can't we focus on the mental health? A big question. And we always tell we have to prioritize on the mental health services, reduce the stigma, and we have to improve on the services towards counseling and treatment. And largely strengthening the public health care. A lot of investments are going around. I think all of y'all would have really had some time to go check out. I think I'm visiting the tertiary care hospital. Sometimes it is so alarming to see really the improvement is so good. We're able to walk in, but still resources are very constrained. Might be the infrastructure is improving, more on the logistics and the resources, more investment needs to be made. Then coming to the social determinants of health, I think this is the most important. I think Dr. Ravi Kannan would be dealing more on this, how the resource constraint setting impacts the health as a whole. So tackling poverty, unemployment, poor living condition, all these things are very, very important for a healthier environment. And largely our social support system, our choices of making decisions, everything depends upon how to promote our own lifestyle. So a lot of health related campaigns are required more at the rural level to just promote nutrition, exercise, and overall mental well-being. So in conclusion, I wish to tell that health is very, very essential. We have to really focus this on a holistic approach, and we need to bring about health reforms that provides emphasis on access and equality to boost up our happiness and provide the goodest well-being to all our citizens.